and there are studies that show it actually decreases the risk, but the overall relative risk neither increases nor decreases. And like I told you, for the BRCA gene, if you carry the gene for breast cancer, putting you on the birth control pill dramatically decreases your risk of ovarian cancer. So you might say, well, what about breast cancer? You know, the risk is so high of breast cancer, 87%, up to 87%, nobody thinks it increases it at all. And therefore, the risk of, the benefit of going on the pill is that much greater in terms of decreasing your risk of ovarian cancer. So if you have friends, if you have colleagues, if you have people you work with, and they have a history of breast cancer, themselves, their sister, their Ashkenazi, be nosy. Ask them. It's so under-tested, it's unbelievable. Just say, have you been tested for the gene for breast cancer? Has your mom been tested? Everybody shouldn't be, no, necessarily. But if somebody has the disease, I mean, I've seen families, it come out in families, it truly is life-saving. It really is. To be able to make that diagnosis before anybody gets disease, before they get ovarian cancer, before they get breast cancer, it truly can be life-saving for families. And it's unfortunate sometimes that somebody has to come down with the disease first. That has to happen sometimes. But then to not test, and to not test because they're afraid. Now, you can't poo-poo someone being afraid, and you shouldn't push them, you know, to a level that makes it. But I think really the way that you talk about it and let it settle in a little bit, and let them really know, you know what, if I have it, I have it. I can put blinders on and ignore it, but if I have it, I really do have it, and I have a choice of whether I'm going to try to prevent something or just let it ride and treat it once it comes. So I think when people really hear it that way, they do change their mind, almost all the time. So, okay. So that's breast cancer. And, you know, the good news is we're doing really well in terms of taking care of it. And I think that there's tons of fear of breast cancer. And what I try to tell people is don't be afraid. Just get tested. I mean, that's all really you can do in life with anything. But don't miss your mammograms and do your breast self-exam and be cognizant. And if you have symptoms that are unusual, you have a bad pain, even though pain is not a symptom, but if it comes and it's there, go check it out. You know, just be cognizant of it. Don't be afraid of it. But I think what we should think about even more, so this is one more step in the screening, is heart disease. Nobody talks about heart disease. Everybody talks about breast cancer. But no, heart disease is really the #1 killer of women. It is. It's huge. But nobody really talks about it very much. But 1/3 of women die of a heart attack. And they still do. So really that, I think, is a really, really big focus needs to start coming in terms of screening. Cholesterols need to be screened on a regular basis. There's a test called C-reactive protein. It's cheap. It's like $12. It's not a slam dunk test by any means, but it's a very rough screening test for coronary artery disease, for heart disease. So make sure that your doctor's getting that on you, and to see where that falls. Family history, that's the #1. You know, what's your family history? And even if your father or mother, you know, ate chopped liver and fat and, you know, all of that stuff and never exercised and smoked 2 packs of cigarettes a day, I mean, that matters a lot. But still, there's, you know, people do that and don't get heart disease, and people do that and have a heart attack when they're 40. Yeah.
What's your take on annual physical exams? Because during an annual physical, you'd have your blood drawn, you get a full panel, you would get all of this. We were just talking about this.
Well, that was my first thing was an annual exam.
Right? Wouldn't the C-reactive piece also be?
Well, unless your doctor orders it, they have to check it. Right? Depends who's doing the ordering for you. So it's not all doctors don't get C-reactive proteins. I think most do now, but not everybody. So you could just say, are you getting a C-reactive protein? I think more do than don't now. So, but yes, this is, the first thing I said was get a doctor, right? So it could be your gynecologist if they act like an internist, or you have an internist and a gynecologist, doesn't matter. But you definitely need a doctor that you can call and ask and that follows you for all these things. And a lot of internists, you know, do all of this. Some of them do pelvic exams too, and that's great. If they feel comfortable doing it, that's great. They can do a full pelvic exam and, you know, they can look, vulvar, vagina, everything else. I don't know that they all feel as comfortable, but if you have one that does, then my guess is they feel comfortable. And that's fine, you know, it's perfectly fine.
But are they as equipped as a gynecologist who sees it every day?
You know, it's a good question. I mean, I would say that as I'm a gynecologist, and I do internal medicine. I don't do internal medicine.
Right.
I shouldn't say that. But I am the primary care for most. Do I feel equipped? 1,000%. I think I've picked up more thyroid nodules, enlarged spleens, everything, because I really take a lot of time to examine my patients. So I feel equipped. Now, do I feel equipped in managing cholesterol? No. Do I feel equipped in drawing it? Yes. Interpreting it? Yes. Putting people on diets? Yes. Rechecking them in 4 to 6 months? Yes. Nothing changes, I send them off. So you have to have someone who feels comfortable with their limitations. I will never tell you there's not a good internist out there that can't be just as competent. If she sees a ton of women, or he sees a ton of women, and feels really comfortable with a pelvic exam, great. What I find is if there's anything the slightest bit off they see, they usually ship them off. So if I saw it, it would be nothing, maybe whatever they were seeing, but they're uncomfortable. So it's also, if they know their limitations, and they see something that's off and they send it, yeah, I have utmost respect for somebody. I think some of it will be your feel. When they examined you, they feel completely comfortable doing it. So.
And Toby, at what age do you start getting the heart disease checkup as a part of your physical?
Right. Well, the cholesterol I start doing in your 40s. Okay. Now, do you do it every single year?